Good evening, good evening. Thank you so much for still being here. Can we just start with a few deep breaths? We have been constantly listening, and there have been so many amazing things that has been said here today that we would really want to incorporate in our practices, and not just in our practices, first with our own lives, that is. So we will start with a few deep breaths, come back to the present moment, that is, correct? And then connect to the panel that we have at hand. So I'll just introduce myself. My name is Pratusha Chatterjee. I'm a psychologist working for the past 14 years, a clinical hypnotherapist, CBT practitioner, trainer and mentor. And this was a very all of a sudden thing for me to know that I would be moderating. I had no idea. So, however, we are going to come to the panel and understand some of the most trending work that is happening with mental health, which is basically AI and mental health. Correct. We have been speaking about the social media aspect also, the technological part of mental health, and we come to the understanding that it has both the positives as well as certain negatives. And now we are going to focus on a very, very specific aspect of it, which is going to be AI. Now, AI and mental health, this combination is new. Even though a lot of people are talking about it, for us to understand exactly what is AI and what exactly it can do with mental health is something that we want to understand today. So first is, I would like everyone to introduce themselves with one or two lines so that we can understand what exactly it is that is happening with AI and mental health, and then we can go down to the questions. Okay? Yes, we will start with Sandesh, sir. Yes.
Fantastic.
Yes.
Hello, everybody. Good evening. I know we have a small audience, but hopefully we make it interesting amongst ourselves.
That's the best, right?
So
you get to interact more with less number of people. Yeah.
So I come from a background of running a mental health services organization. We've been in this field for about 32 years now. We have a whole range of services, residential care, de-addiction services, psychiatric hospitals, preventive and promotive mental health programs. For us, adapting technology was more of a necessity, and then investing into AI became a way of life, to be honest. So it's more like a commodity, and I take opportunities to be part of any forums and panels where we're exploring what the future will rests in mental health and AI. As Kadavam's group, we've diversified into physical health services as well. Today we are in physical health rehabilitation, an exclusive center for geriatric care, senior care that we work with, and child development programs that we run. So that's what I bring to this forum, and happy to share a few use cases. So a lot of things that we started was doctor first. So everything that we did AI, everything that we did technology was to assist doctors, enable better service deliveries, and so on and so forth. So you'll hear me talk about that. Yeah, that is to introduce myself. This is the work that I do.
It's very interesting. Why? Because I would want to understand from you the shift when you were working and say the time where you were not that much involved with AI, and now that you are, can you see the differences over these 30 years?
Well, I mean, I've not been active for 30 years, but I come from a founding family that was there.
Of course.
So, yeah, I've been in the realms of these things for the last 15 years, but that's been drastic.
Yeah.
So the last 6 to 7 years is where I see these advancements extremely high. And more so in a scenario where we work with governments today. So we have the opportunity to run mental health services for a couple of countries, build frameworks. We're there in Bangalore, Hyderabad, and a few other states as well. So we'll touch upon that as we go along a few questions. I don't want to hold everybody else back. But yeah, this is the work that we do. Thank you.
Thank you so much. Yeah.
Good evening, everyone. We are just after the tea. I think everyone is busy with the tea or coffee, whichever is your poison. So I am Jayant. I am the founder of a mental health startup called Tranquil Mind. We are based out of Bangalore. And in India, it's going to be the first time where you will see 3 technologies getting married together. So AI, AR, VR, and neurosensory. And we are targeting to connect the complete dot of the mental health care, from diagnosis to prevention to treatment to care. Personally, I've been associated with technology for almost about 15, 20 years, and my forte has been AI, addressing AI or AR, VR, or automation, addressing business problems, so B2B. And that was the shift that if technology can do X things for a company, it can also create X impact for society. So let's use the technology for good. So one of the topic which was discussed. Thank you.
Hi, good evening. I'm Dr. Nabit from New Delhi. I am the founder of Peaceful Mind Foundation and the World Leaders for Mental Health. So Peaceful Mind Foundation works on mental health services, of course. We majorly focus on every person in the community from below to the top. And the World Leaders for Mental Health is the forum which I started on in 2020, which works with all the heads of states in various countries, framing mental health policies and getting them to the United Nations.
Good evening, everyone. I'm Ipsita. I'm a practicing psychotherapist and I have my own organization. I'm founder of Thera, Unwind Your Mind. And I used to be a practitioner who would, go to a clinic, see your patients, go back home, right? And then the pandemic happened. To give you context, a lot of my work was initially with domestic abuse survivors. I'm a practitioner who works more with trauma. And in the pandemic was when I understood that a lot of therapeutic work had to be done on text, because they are with their perpetrators, right? And ever since I started consulting in an organization called Visa, and I'm looking at hybrid models, right, where there is AI, but there is also a therapist present, and how we can integrate that. And that is also the perspective that I'm going to bring in, working with those in the margins, working with places where mental health access is not very present. So I'm very interested being here.
Hi everyone, my name is Apurva and I'm a psychologist. I work with Elephant in the Room Consulting. It's a corporate mental health organization and we facilitate a lot of awareness workshops, capacity building training programs, and a lot more, like working on policies as well for the organization and processes, helping them create more, I would say, safe environments and workplaces. And we've been working on a lot of cool things like a learning management system platform for corporates where you have these small, digital modules to create more awareness about mental health, where it's like self-paced learning programs of sorts. So yeah, thank you.
Yes, you can just pass it. Yes. Okay, so we will start with the questions and trying to understand that how beneficially AI can actually affect the field. Okay, so this is my first question because of the curiosity of trying to understand the difference between the space of working without AI and working with AI, and how beneficial is it? What is the sort of the beneficial areas that we are looking at? Because a lot of people, they would start with the not being able to understand that how much will it be applicable and how beneficial can it be. So whoever feels free to answer.
Awesome. The legacy comes its way. So awesome. So I'll tell you where it comes from, right? Again, we'll keep it doctor-centered, therapist-centered. There's a lot of documentation and workup the clinicians have to do. I'll move a little away from outpatient services, more so for our inpatient care, psychiatric emergencies, or short-term rehabilitation programs. Just to give you an inference, one psychiatric hospital admission, our psychiatrists would do a workup of about 18 to 24 forms. Right? So this is quite a detailed examination, documentations that used to happen. So for me, now that you're asking me, the pre-AI era was like you go over these physically, you make sure you have a data transcriptor, you had somebody else doing it for them because you don't want to burden clinical hours doing all of this, right? And then you go through a verification and there was these tools. Today we've been able to use, you know, transcribers which are intelligent. So you know these conversations or instructions being given. I mean, we call her Dr. Ria. So so we say to what is our doctor assistant, a dictation or an instruction given to our assistant will take care of those things for the doctor, right? Okay. So they don't have to go over. There is still a verification. There's still that signatures are. Our medical legal approaches are such that you still need a physical form that can be scanned down and put out there, which is still fine, right? It is now reduced 2.5 hours of work to, let's say, about 10-15 minutes if it's done more efficiently. So this is one inference, but a lot of it is really about now exploring and assisting our clinicians about what is in it to stay in touch with the recovering individuals in between treatment, in between therapy. Like Tranquil Mind, Jayant also mentioned, you guys have, he's working on getting various tools of AR and VR. It's now about how can you track recovery, how can you track progress. That's something that we are now investing into as we go along. But these are just a few instances. I can go on, but just the curiosity, this is where we lay out. I'm sure there will be plenty of things we could do for patients, but at the moment we're very centered around building the doctor intelligence, the doctor assistant. We believe if we master that, there's always a room to work on the patient side of things. We know what the patients require. Yeah, that's my take.
That's a very important part. All of the psychologists over here, we do spend like hours. We do.
I missed mentioning psychologists, but I meant psychologists as well.
Yes. So no, I am reminding you, all of the psychologists
I should have rather said MHPs, mental health professionals.
Absolutely.
But yeah.
See,
that's what we need to do.
Absolutely, I'm sorry about that. Yeah, the mental health professionals, yeah.
So we do have that issue, right, with so much of writing, and if you don't do that, it doesn't work well. You have to do that. You have to maintain the case. You have to understand the case, analyze the case. All of those things can be done really well if this part of the work that you're saying is being trained by the AI to do. That's amazing to hear. Okay, so another question is, so this is for you, Jayant, okay? Major challenge in mental health care is affordability. You know where I'm coming from, right? How can AI-driven solutions help bridge the gap between cost effectiveness and meaningful care?
Good question. Yes, AI per se is an expensive affair. Okay, that's global debate. Should world adopt AI or should world stop AI? Because I'm just going back to the history to give you a perspective. How many of you all are using ChatGPTs or anything? Okay.
All of us,
everyone, right?
Everyone, yeah.
One sentence, which is about 10 or 15 words, if you're asking an AI, it is galling about 2 buckets of water behind. Okay, so that is the usage of water getting to cool it down. So you can understand the heat which is generating. So now you can just put that one, how many people are using, how many times it is using, how much heat. So that's another debate, totally. That should it continue or not. So it's a costly affair. Now the thing is that AI can play into multiple facets of life. So the first part where AI comes into a very useful way is early detection. Now, fortunately, unfortunately, we are all human. We have a way of expressing ourselves. This AI can now be used to understand your emotion, the way you speak, the way you talk, the way you express, the way you write. So I can teach that AI to understand the first detection. Nowhere it is that, it's been said that, it's going to work as the boss. So it has to be human in loop. Okay? So at some place AI has to give it over that, okay, this is my analysis. This is my early detection. This is my first responder. And here I think somebody else has to take over, depending upon the type of problem this AI is going to segregate. This will make affordable. Okay? And when I say affordable, that means I'm saying that, everyone is suffering from mental health problem. We accept or we don't accept. But that should not be defining that, okay, are you eligible for care or you're not eligible for care? Everyone should be eligible for care. Now, since we are using mobile phones, use it for good again comes into the picture. If you put something over there which can ask, you can just talk, and then it gives you that, okay, this is what is, you need a care. I cannot give it to you. I will connect you. So then it becomes more affordable, much more addressable, and that's much more impactful.
So this also sounds to me like a lot of people right now are also going through the problem of, do I have a problem? Like a lot of people, they will not approach a psychologist, they will not approach a psychiatrist because they are unsure, do I have a problem? What if I go to somebody and the person says that this is not a problem at all? So do you feel that this gap can be looked upon where if they are unsure, they don't know what it is, that part can be cleared?
Yes.
Through this particular process, is that what you mean?
We have to go back to human way of interaction. Today when we talk to somebody, there are situations when you expect somebody to give you advice, suggestions, and there are situations where you expect somebody just to listen.
Correct.
Okay? But our human mind gives you the option to be active listener. We have to respond because we have to either be the boss, we have to control the... AI will not act like that. So AI will act like, okay, I'm a listener, tell me. Now when situations like this, what you're picking up, it will be able to detect emotions. So when it is detecting emotions, so just think now, I'm just trying to picturize the whole scenario. This AI is able to understand your stress levels, okay?
Mm-hmm.
Based on your stress level, is able to define what is your problem.
Okay.
And then tell you that, okay, are you comfortable? I'm telling you the truth because that's the time of, so you need something.
Correct.
You're not mentally ill, but you need somebody to talk to. And that will make that particular connection between the human and AI.
Okay. So that's again a very interesting part of it. More questions. Lot of questions come into mind when things like this come up, and basically I think this is a good area to discuss all of the things that come to our mind. Okay, so I have another question. Now, okay, so this question is for you, sir. And so in long-term mental health and care rehabilitation, what role do you feel that AI can play? Would it help in patient recovery and ongoing support? If yes, then in what manner, like in what way?
Okay, so honestly speaking, I am not using AI that much. Okay, I am a person-to-person person.
Okay.
And being a therapist, I feel that human interaction and human touch is very important.
Absolutely.
Because human mind is very complex.
Correct.
And what AI can do, I'm not denying the fact that it makes your life easy. But we, as even professionals, we have to limit, because that will automatically tune us to not think, not explore,
Correct.
Yeah,
the other
not
side
make
of it, yeah.
judgments. And
Correct.
it will make us lethargic.
Basically the analysis part of it.
Yeah, the
that we are
analysis, the
always
cognition
doing.
part will,
Correct.
it will start diminishing.
Correct.
I mean, you will be so in tune to something like ChatGPT. I'm not against it, but still.
Correct.
So as a therapist, I am not denying the fact that AI can help us in diagnosis and, database analysis and facial recognitions and all. But that human touch, that human feel and that human emotion is very important. See, what a therapist can do is actually see your verbal and non-verbal cues of the client or the patient, whoever is coming. And then he's also culturally accustomed to, get accustomed to the patient. AI is just programmed.
Correct.
Similarly, as a therapist, I mean, most of the psychologists we do, we all tell or preach, do not Google. We all do that, right? Because वो तो एक list निकाल देगा.
Correct.
उसमें से आप hospital पहुंच जाओ या आपको क्या हो जाए आपको खुद नहीं पता. But human being itself is so complex. So human to human interaction, I feel, is much better. AI can be an assistive tool or a support system.
Supportive.
But not just AI or
Absolutely.
a therapist.
Okay. So there needs to be no segregation between the two,
No.
but a supportive relationship
Yes.
between the two in a way that is... So we have to look at AI as like... is Yes, augmenting us.
Basically facilitating your work,
Facilitating our work.
but not overpowering you.
Not doing my work.
Yes.
Helping me do my work.
Yes.
That sounds better. Yes, yes. So this particular question that I asked, is there anybody else who would like to add on anything over here? The question that I asked? Anybody?
So you asked about long-term process and help, right?
Correct. Yes.
So with AI, it can be done with a lot of mental health resources that can be provided to someone, like maybe mindfulness exercises, or breathing exercises,
Correct.
or maybe audios that can help them later on,
Right.
that they can use for self-help.
Right.
So that's how we can use and support AI. But I truly agree with Nabit where he says that it has to be integrative. It has to be like AI assisting, because you can't take out the human from that process, right?
Absolutely.
So I think it's very important for AI to assist, but a therapist or like a mental professional to also be there present in the whole process. So even when, so I agree, I do agree that it makes the process faster when it's about initial screening also. But there's like a mental health professional has to be there to review that also, because a lot of times AI works on algorithms, right? I'm not a tech expert here, but I think it works on algorithms, right? So so you teach algorithms to AI. That's how it works, right? And a lot of like AI, they use CBT and a lot of other processes. So when it comes to therapy, like one-on-one therapy with a client, if it's a therapist, you are able to understand a lot of non-verbal cues, the tone, the voice, and a lot that changes also while talking to a person, right?
Correct.
And as a therapist, you are able to catch on to that, and then you maybe change the whole approach.
The EQ part of it. Right?
Exactly, the emotional intelligence part. So I feel therapists, like a human connection is very important, and AI can assist it to make it a little more faster for maybe initial screening, red flags, but for like meaningful deep therapy, you need a therapist.
Correct. Yeah, please.
So just deviating little bit from this. So when COVID-19 happened and before that, I am one person who was not even accustomed to online taking sessions for some reason. I want a person to sit in front of me because a therapist will see a lot of things in that person.
Absolutely.
And Zoom or Google Meet will not help. But after a lot of self-tutoring myself, this is the only way, now you have to go ahead. So it makes sense. But for AI to do all the work for you, I think that wouldn't be justified.
Absolutely.
Being a therapist and being into a mental health profession.
Correct.
So, fact that you wanted another perspective, or if there's something more to add, I'll come from a different perspective, which is for more so for persons with serious psychiatric conditions, right? Who have gone through, who faced this illness or conditions for a relatively longer period of time. There's a caregiver burden. There's a social support system which is fragile or challenging. Where I see AI aid long-term mental health recovery is it to play that role of assisting and supporting them. It will never replace mental health professionals,
Correct.
let alone therapists, let alone social workers, psychiatric nurses, or even your psychiatrist. I mean,
Right.
the balance will have to be there. But it is required for assisting them. Now, persons with serious psychiatric conditions, let's take for instance schizophrenias, have a problem with ADL, right? And you're reintegrating them after long-term rehabilitation programs of about 3 months, 6 months, who've never stepped out to a social occasion, who have never gone out and experienced what is it to being in the society out there, and now suddenly are living all by themselves at home. Can I get a ping? Can I be reminded? I mean, how long should I be told to take medication because they're my parent, and how long as a parent I have to ask for medication?
Right.
These are questions that we are still exploring, we're trying to solve. It has been used in a few hundreds, few thousands as I speak to you all. The internet is weak here, otherwise I would have demonstrated it as well. So a lot of things that Jayant was talking about, it's important to triage. They maybe don't want to Google, but where do they go to? Where do they ask that I didn't sleep well because I've not slept for 3 days? Is it a sign of my own relapse? Now that's a problem. Now, can we address these things in a better way? It's not that they should not be going to a professional, but this is how I believe it could be AI, it could be any other form of technology, I don't care. But if it can solve our recovering individuals' problems, the users, the caregivers, it helps, right? And if it helps the mental health professionals, why not? Yeah, that's my take about everything, how it should be helping or what we should envisage. How it will happen, I mean, time is a test of itself. So,
Because that makes sense to a few things. Because of course, searching to Google everything leads to everything. Like, so it's one of the first things that we do. Please don't Google. Now, the thing is that so many people have come to me and they have asked that, do I really have to, like, is there something wrong with me? Like, and they are like, I am struggling with this particular question for the past 6 months. Now, where do I go to? So, if you have to approach a psychologist or you have to, so ठीक है ना, फिर तो counseling के लिए ही चले जाए ना. If I'm just going to ask for this question, so who do I ask this question to? So this was one of the areas that I was coming from, and from what you are saying, if it is guided in a better way, not leading to, say, adverse effects like the Google effect is there on health and everything. If we can reduce that effect, then we can utilize AI in a way where, it's better able to answer questions that has been posted to it by so many people. Okay, so really nice.
Add only one point to his, okay? And probably this is going to be contemplating. Okay? Everyone thought once that when computer came, it will destroy life.
Correct.
Okay? And then suddenly we realized that over time, the work is getting faster.
Yeah.
Okay? Then came Word. Now the writing thing got faster. AI has just begun. Okay? It is also going to go mature enough. It will also start understanding it. Today, what is missing in AI is the empathetic part.
Sure.
Okay? It is not much time that it will understand human behavior, human emotions. So the contemplating part is that there is going to be time, maybe 1 year, 1 or 2 years, every medical health professional has to upscale themselves. Because now 50% of the case AI is creating and giving it to you that, okay, this is my boundary, now you need somebody to talk to. Okay. So the health professional has to upscale themselves in the part of knowledge, understanding that language, skills, that, okay, my 50% of time which I was supposed to go into diagnosis, probably, I was supposed to do 10 sessions, my 10 session ka cost has come down to 5 sessions. How do I compensate? So all those thinking now will probably, then I will try to do 1 hour ke badme 2 ghanta leta hu main. Mera wo recover karne ke liye loss. So that has to get upscaled, so that you become much more polished. This is a problem statement across. It's not, I'm talking about healthcare. Okay, it's everywhere and it has already been proven. Today, AI is able to create videos. Best photographers of big studios, they are creating, and now they are thinking, how can I upscale myself? How can I create a better video from this? Okay, image. How can an artist create a better image from this? That is the human part. Use that human now in the next level. And that is going to be the contemplating when this AI clashes with your skills, where the AI wins the skills. So that is the place I'm saying that everyone has to upscale themselves.
And over the same question, like to you, Jen. Now see, the use of VR and
neurosensory.
Yes. So can you talk about that a little bit? Because
that's the future of mental health. Okay?
So why am I asking you to do that? Is because we are looking at long-term treatment. If you are looking at long-term recovery and adding AI to that, so just to give an idea, as a therapist, when this came out, it felt like a blessing to me. As in just thinking about it, because somebody with phobia who's sitting in front of me and I have to make the person imagine. Right? We go through the entire process of desensitization where we will make the person imagine this, and then slowly sensitize them towards everything. Now, if that can be given in a much more realistic manner, knowing that still they are safe, wouldn't that help?
Of course, it's going to help.
In phobias,
traumas.
in traumas, and all of that. Can you elaborate on that? Because that came out really strikingly, and that's something that we are doing any which ways.
So the future of mental health means, at least for us and people who are very close to technology, we as a company, Tranquilnet, we believe it has to be a marriage of three technologies. AI will detect, early detection has to happen, okay, which will augment the human side. That when a therapist comes in, therapist knows that, okay, what has happened, because objective, what we are talking about is that no problem is that day's problem. It is coming over a period of time, okay, whichever problem you talk about in life. So that period we have to understand where it is. So once you know that, okay, this is coming from this types of conversations, this types of engagements, this types of environment, it becomes easy for you to address now that problem. Now the problem is phobia, trauma, different types of, memory loss is another problem. It's a big above, 70s, above 80s, above. I have psychiatrists over here. You're also psychiatrist, huh? No, sorry. We have psychiatrists. Or if you pick up any psychiatrist, they will say even a 30% recovery in memory loss is a win. Okay. Now those things we can now put into virtual reality, where I can create an immersive experience and take a user to this called as exposure therapy. Okay, so you are exposing a user to the type of trauma, phobia the user is, which is very difficult. The counterpoint of the earlier point, it was discussed that physical, you have a test, detection, ho raha hai, yahan pe nahi ho raha hai. Okay, so now I can use VR as a detection, take you to different heights, different environments. Where is the problem? Now this problem to track is neurosensory, is the biofeedbacks. So your brain is active always, okay? It is going to react in different scenarios. This signals has to be caught and say that, okay, this is the place. Once a psychiatrist, psychologist knows, okay, what I'm talking, so now they can plan the next step, okay. The person is, I'm giving you how many means, probably a lot of people over here is scared of cockroaches, lizards. Okay, any of the psychologists can create an environment in their office? Get 100 and then put the patient, okay, now see, I will put one, no, right? So now you know, so now you can expose the person, so that is virtual reality. And this, when it's get attached with neurosensory, I'm getting the exact detection of what is the problem. And that is the future of mental health care.
That's good. Yeah. But it, again, it's going back to the therapist.
Yeah, of course, everywhere it has to be human in loop.
Okay.
It is human in loop.
So this question is for Ipshita. Now, one of the AI's biggest promises is expanding access to mental health care. How can hybrid models combine AI with human-led therapy, help communities with limited access of care?
Beautiful. So I think this is where I come in, right? Because a lot of my work has been with the margins, with people who cannot really access. So when I begin my, introduction, I told you, it was about women in the pandemic living in domestic abuse situations. And then who do they go to? How do they go and access anything like that, right? So a hybrid model like that, firstly in India, if you've worked in this field, you would know, a lot of people we work with do not really know what abuse is. Right. So AI comes in where you talk about some things and it can detect and it can say, are you feeling safe? Here are some things. And if you would like, let's talk to a therapist. Okay. Similarly, I think the previous panel had Richa and they spoke about how, the diverse population, LGBTQ, also need help. Again, it was criminalized in our country until very recently. Okay. So communities that cannot access or do not know if therapists is a safe place or not, AI and then maybe a hybrid model which can take them to, let's say, a text-based therapist first, right? These can be healthier spaces, okay? The other thing that I think of in general is how at VISA, where I consult, we say how it can be a missing middle. Right? We are not replacing anyone in any way, but we are also saying it can be a missing middle between going and walking into a doctor's office, into a therapist's office, and also not doing anything at all. Okay? So it bridges these accessibility gaps. And now if you look at rural areas where this is not talked about at all, right? There can be scalability programs in, in contingent with the government, where we can look at language sensitivity, cultural sensitivity, and include that, right? There are places where there is caste discrimination, class discrimination, and if we can have models that incorporate ideas on how to work, ideas on seeking help, ideas on sensitizing everyone in a community, right? And at the same time, I think in the previous panel, Dr. Chetna spoke about systemic versus individual, right? So maintaining that human connection and bringing it in together, okay? So maintaining human connection by saying, okay, let's, for instance, if just while building the AI, while building, and again, not a tech person, so don't hold me for it, but if we can access community leaders before anything, okay? So if for my community, if it's something different, for another it's something different, we can access that and program it in a way where if in a place there is AI that can tell you what's happening, it also incorporates your environment, right? I think that is really what we need when I'm talking about bridging the gap. I hope that answers your question.
Of course, that's really nicely, beautifully said. Thank you. And the question for you, Apurva. Okay. So beyond diagnosis, what role do you see AI playing in therapy? Can it provide meaningful interventions, or is it limited to being just an assistive tool? I know we have, in a way, answering this question, but just inputs from you if you would like to go deeper into this idea.
I'm going to reiterate on that point. You can't really take out the human from that whole exercise.
Absolutely.
And like I said, if you're talking about interventions, it can assist with like initial screenings. I'm going to back up Ipshita here, where she said it can be more scalable, right? So for underserved areas where therapists can't reach, or a mental professional can't really be there, there also AI can help with like initial screenings, and then it can come to maybe a mental health profession if they really need like deep work. Also, like I said, different resources, self-help resources can be provided using AI to people during recovery, during their with therapy. A lot of these practices, self-help practices, can help person recover faster. So I think there also AI can help. Yeah, that's about it.
Yes, I think we're running out of time. If I was just going to go out for questions, please, anybody, if you have a question.
Not a question as such. Like what I find out is therapists can't be available every time with the client. The AI can be a boon for them because constantly they have a thought. And as we all are mental health professionals, so we always give this advice that any new thing comes to us, so we reject that. Our brain rejects because it is not there within. So whenever anything related to social media or AI, because we are not born in that era, so as soon as we accept it and we start working on it, so that will be more good for our profession to hit and get a boon. And let's make more of the uses of AI, because see, when we are getting an unpaid assistant with us, so why not to use it? When it is free, then why not to use it? And to make our therapies more available, like as an assistant we are giving, because if you have any problem, my assistant is there with you. The client will feel more happy. And that too, yeah.
I'll just add to it. Yeah, I'll just add to it. Our principal ma'am, she has just now recently launched her AI avatar. So this is first of its kind, and the principal is in the avatar. She is answering to questions and queries of parents for new admissions, for life coaching, for career guidance, for anything and everything at any given point of time. So you can access it.
Your
So
school will be the most strictest school in this world, probably.
No. It is just an initiation.
Well, no room left for any mischievousness at all.
Yes. Thank you. My question to Jayant, because you are a startup and you are helping actually all the mental health issues with AI. So I want to tell you one thing and how you can help tell me. Most of the MBBS students,
those who are pursuing MBBS, first year, second year, third year, fourth year, out of 10, 3 students are depressed. I'm telling you, it may be more than that. So how? No. Especially MBBS, because they are future doctors. So please, how you can help those students? Is there any kind of device or any kind of?
What we are trying to build.
So that is the thing actually which I am.
Part of our thought is that every person should have a companion in your pocket. This companion is so I have heard of somebody talking a big word and it really hit me. And the word is it is a privilege to have a friend.
Correct.
And in this world, people who have they should be blessed. That
They are
have.
blessed. Yes.
Okay? But 80%, 90% they don't have.
Correct.
And that's one of the biggest reasons of all types of disorders.
Yes.
If you are able to submit that loneliness part, and give somebody a companion with whom they can vent, talk, nobody to give them a judgment, 80% is success.
Correct. Correct.
That is what is our goal of what we are trying to build our area.
Correct. And since I am working with all NEET aspirants, and when they take admission in MBBS, for the medical college, they are facing this problem. So I want to address that.
I am 100% with you.
Correct.
I will just mean, you are saying MBBS, I've talked to
Even PG students.
MBA students,
Yes.
everyone is going through that.
But
And today another flare is happening with all these 10+2 colleges because they are getting pressured to get into MBBS or
Correct.
engineering.
Correct.
So it all starts from there. So that's why you see so many suicides happening at this young age.
yes. So that is why actually this thing should be addressed ASAP, and how you can help.
I think we should connect.
Correct.
Connect, and I will tell you.
Yes. Thank you very much. Thank you. Sorry.
Hello. We meet again. 2 points. First, I doubt if anyone has seen the movie Control CTRL on Netflix. I think that's the first, sane movie that Ananya Pandey has done, and she has done a good job. So she also wanted a companion, but ended up. You all know the story. She ended up in a worse state than she was in before. So I think everyone should watch this after this panel discussion. So second,
I will have an objection over here.
okay.
The whole movie world shows you great pictures. Okay. Now, if you want to live with that movie world, you are living in a falsehood. If that is your benchmark of this is my lifestyle, then you are living in a falsehood. You will see people coming from the movie world, not studying, becoming first. So great movie, 3 Idiots. होगा क्या सही में सर? होगा कोई?
No.
कॉलेज से आप रेस्टिकेट हो जाओगे. Okay. Forget first degree.
No, I meant if you want a companion, then AI can be your companion. It will hack into all your file. It will hack into all your bank and.
It is already hacked. We all know that. Once we have signed in Google, we are hacked already. We are living with that fact.
Or at least it has some restrictions. It has some government policies attached to it.
Okay, if I can quickly, I think because we
ठीक है,
didn't have the time, I couldn't
ठीक है,
get into that.
that was just वो companion वाला आ गया इसलिए मैंने वो किया.
Can you ask your question?
And the second thing is okay. So the topic is for the diagnosis of mental health. So currently psychiatry diagnosis is done by 2 major classificatory systems, like DSM-5 and ICD-10. So both of these leave clinical judgment by a psychiatrist. So they are not foolproof. Matlab, they leave judgment by the psychiatrist. So if you leave AI to do the diagnosis, that crucial 5 to 10% of clinical judgment by a psychiatrist is left. So we have unspecified anxiety disorder or unspecified skills or unspecified NOS criteria, not otherwise specified, where it does not fit into the tick box model of, so that category is going to be missed long term. So that is also an issue with AI if we bring into the diagnosis world.
Yeah. So I think one of the things that we spoke of as a panel collectively was hybrid models, right? We are not talking about apne DSM ka data feed kar diya and tick, tick, tick. Because because we didn't have the time, we couldn't talk much about the risks and the ethical concerns, right? If you look at DSM-2, there is the whole thing of cultural sensitivity. There are so many diagnostics which we are not going to give to our clients because of the culture that we come from. Okay. There can also be a bias in training data. So when I work on gender sensitivity with young students, I was just showing it to Mr. Sandesh. I showed them how I asked ChatGPT, can you show me the image of a CEO? It showed me a white male CEO. Then I said, why is it a man? So it showed me a white women CEO, right? So I said, why is she white? So it showed me a brown, lean, perfect hair, perfect skin. It took me 13 iterations to get someone who looks like us. Okay. So there is going to be bias. There is going to be all of that when we feed it to data. So the gender sensitivity, cultural sensitivity, DSM in itself is not always created for us. Right? So hybrid models mean that we work in tandem, together, collectively with AI. We are not competing with each other. Okay? And there is still, what about data privacy, right? What about security? If there are things like homosexuality which get criminalized and then decriminalized and then criminalized against, can it be used for surveillance? So all of these things have to be taken in consideration ethically when we build AI for mental health. I hope that answers your question.
Okay, so we do not have that much time, but this is, so am I allowed another question, one last question? We are very sorry. So, yes, so this has been an amazing topic, and this is a very, very interesting part because we have to move towards a space where we are able to make mental health more accessible and more affordable, more approachable. So it needs to be that. We are moving towards a time and space where mental health is not doing great. So that's an acceptance first that we have to do. Thank you so much, amazing panels. And it is an amazing opportunity to ask all of these questions. Thank you so much for the insight that comes from the audience. And I hope we can do that again sometime. Thank you so much.